Today, I want to talk about bone health because it is a hugely important thing if you want to age powerfully, gracefully, and well. So when we're looking about longevity and keeping up with all your dreams, and now you finally have the chance and the time to do the things you want to do, you don't want to be fragile. A very scary statistic is that for women who break a hip, it's one of the leading causes of loss of independence. You end up in a nursing home. And the mortality rate within a year of breaking your hip triples from whatever your mortality rate would have been prior. So this topic matters a lot. And there's a huge misconception out there that bone loss is related to calcium deficiency, and that if we just take more calcium, our bones will be stronger. That's a massive error in thinking. Osteoporosis or osteopenia, which is thinning of the bones, but not to the degree that we call osteoporosis, the fragile bones, the weak bones, the bones that break easily, it's not an issue of not enough calcium. It's a mismanagement of calcium. You see, calcium leaves your bones and it deposits in your blood vessels and your joints. You get calcified plaque and arthritis. We used to say to women in menopause, oh, increase your calcium to 2,000 milligrams a day, and that's going to protect your bones. Well, that's not true. What if the calcium that you're taking deposits in your blood vessels and your arteries and your joints instead? So there is a very important vitamin that's helpful, and that's vitamin K2, especially the MK4 and the MK7 form of vitamin K. That is an important vitamin that helps to modulate calcium to make sure that calcium goes to your bones and not your blood vessels and joints. Another important vitamin is vitamin D, because vitamin D increases calcium absorption. So rather than just take a calcium supplement, let's make sure your vitamin D is optimized. And optimum is 60 to 80 nanograms per deciliter, not 30. Clearly not 30. That's the bottom level of normal range. And if you're over 40 and you take a vitamin D supplement, you should have vitamin K2 with it. And so we carry a product in our office that has 5,000 international units of vitamin D and a healthy dose of vitamin K2. So for sure, optimizing your micronutrients is super helpful for your bones. And ideally, we want to get the calcium from dietary sources. There's a great resource that has dietary sources of calcium other than dairy, because dairy can be hard on your body. Some people tolerate it fine, but if you don't, and you get an upset stomach or inflammation or anything like that, then we deserve to get calcium from other sources. And certainly milk isn't a most commonly known source of calcium, but there's plenty of other sources. So I'm going to put that resource, a link to that, at the bottom of this video. So take a look. I had a question from a patient the other day that emailed and asked if the amount of calcium in the multivitamin that we carry is enough to support her bones. And that's what prompted me to make this video, because calcium is there. It's a mineral and it makes the bones look dense. It doesn't make them necessarily stronger. It just makes them denser. It's so many other things. We don't just want dense bones. We want strong bones. And so we have to get away from thinking that calcium is the answer to weakened bones. So let me just tell you the things that are important for strong bones. And we already went over two of them. That's vitamin D with vitamin K2. So optimize the D levels and make sure that you take K2 with your vitamin D. And why do I say that you're going to need to take vitamin D? Because I've never met anybody that has optimized vitamin D levels that doesn't take a supplement. We just simply don't spend enough time in the sun without sunscreen anymore. Okay, so vitamin D, vitamin K2, optimizing, super important. Estrogen, testosterone, super beneficial for bones. The osteoblasts make more bone. That's how your bone remodels and stays strong. So hormone replacement therapy is beneficial for your bones. We've known that for a long time. Another thing important for your bones, adequate protein. So I want you to picture a wall, and the wall is your bones. And all we see on the wall is the drywall. And that's kind of like the minerals attached. And that's what a DEXA scan measures, is the density of the minerals. But the drywall is not where the strength of the wall is. The strength of the wall is in the studs in the wall. And let me tell you, protein is the studs in the wall. Most women don't get adequate protein. So how much do you need? Well, almost a gram of protein per pound. For sure, per pound of lean body mass. And in order to know that, you need to get body composition analysis, which is something we do in our practice. But you can find a place locally that can do a body composition analysis. So get enough protein. Strong muscles lead to strong bones because the muscles are attached to the bones and they put shearing forces on the bones. So the stronger your muscles are, the stronger your bones are going to be. And moreover, the stronger your muscles are, the less likely you are to fall. So the better your balance. You know, we're looking at longevity here. So the issue is that if you have weak bones and you trip and fall, you're going to be more likely to have a fracture. If you have weak bones, but you never fall, it's less likely that you're going to have a catastrophic hip fracture. You might have compression fractures in your back. So strong muscles makes it easier to have good balance. Hormone therapy makes it easier to have good balance too. You know why? Because it increases brain health and it increases the ability of this brain cell to talk to this brain cell with their neurons. And so the faster information travels from this neuron to this neuron, the faster your response time is. So if I walk down the street and I hit an uneven spot, I put my arms out, my body responds quickly in order to prevent a fall. But if I don't have good brain health and good response time, then I hit an uneven spot in the road or the sidewalk and my body does not respond in time in order to prevent a fall and I hit the sidewalk. So if that happens to you and you have weak bones, you're looking at a hip fracture, nursing home, increased mortality. Not good. We need to start thinking about this now. 40s, 50s, definitely. And if you're in your 60s and you haven't thought about it, you're behind and we need to catch up. So strong bones, hormone replacement therapy, adequate protein, strong muscles, vitamin D, calcium better in the diet, K2 with your vitamin D. Those are the most important things for your bone health. So don't just rely on these medications that can increase the fracture risk. The standard medications, the longest known medications called bisphosphonates, they make your bones denser, but they don't make them stronger. They actually make them brittle and they can increase fracture risk over time. Yikes, that's scary. That was one of my aha moments as a gynecologist when I learned that these medicines that I'd been prescribing to try to help people were actually, after 5 years, hurting them by increasing atypical fracture risk. That made me relook at everything I did in medicine and say, wow, maybe I'm not doing things right and maybe I need to learn a better way. And here I am today. So I'm Dr. Yvonne Karney. I'm the hormone locksmith and I care about your long-term health, and bone health is so important for long-term health. Look below and we'll get you the information about calcium sources in food. Have a great day.